There has been a very significant increase in the incidence of type 2 diabetes in children. The data is not as complete as for type 1 diabetes in children, but at least in some high-income countries such as the US, we see a multiple-fold increase, and especially in individuals of I guess, non um, for, um, European origins.
I think this is it, our work and considerations are part of a holistic approach that needs to be taken for youth who are living with obesity and are at risk or at greater risk for metabolic syndrome and type 2 diabetes. And those approaches include changes to lifestyle as possible in terms of diet, exercise, and evaluation of known clinical parameters. So young individuals in clinical studies or clinics that are helping to support youth with obesity are providing usually a combination of different modalities to help them to reduce their risk, which generally involves weight loss, increased exercise, and higher quality diet. Um, the ability to track progress and the ability to predict risk can be enhanced by increasing the nature of the testing that is done, and the work that we've done and that Quin and I tried to review in this our recent paper is looking at areas of the intestinal microbes or gut microbiome, and that could be evaluation of gut microbiome samples. Those would be fecal samples, are relatively straightforward to do, and they could improve evaluation of intervention strategies. They could improve prediction of risk for certain cardiometabolic problems that young people might encounter. So I think that would be those would be the best contributions, at least in the near term, for a better understanding of how the gut microbiota are reflective of current risk and may be useful in monitoring intervention strategies.
Well, so this is really a review paper that we looked at for a variety of research. In our most recent study that we completed with colleagues here at the Hospital for Sick Children, we saw that there is actually an parameter that is linked to the gut microbiota and also depends on host metabolism that is associated with metabolic dysfunction, and that is the total amount of gut bacteria. So in individuals with lower amount of total gut bacteria, there seem to be a higher level of systemic inflammation associated with neutrophil activities. And there is also a higher degree of metabolic dysfunction. That said, we do not see a lot of studies that measure the total amount of bacteria in the gut. So we definitely need more understanding and more data on this metric to be able to decide how well it predicts metabolic dysfunction and in other disease contexts. And we also saw that this metric is associated with some bacteria taxa that are associated with pro-inflammatory responses, so such as Escherichia coli. This is one bacteria that popped up in many of the paper that we have reviewed to be associated with prediabetes, type 2 diabetes, other metabolic dysfunction, and then other bacteria have come up as being potentially beneficial for host, I guess, metabolism, and some of them have been tested as next-gen probiotic treatment. Although none of the bacteria that we see that have been tested are showing consistent effect across trials in terms of improving our metabolic function. But just to give some examples, there's Akkermania mucophilia, as well as some, I think, the one that we found in our oh God, I can't remember the name of the bacteria, but some of them have been observed to be associated with better metabolic function. But there is a lot of work to be done to be able to validate their benefits.
I would say that one of the features that we've seen, which Quinn has just referred, is that in studies of the microbial composition and function in the context of obesity and progression to type 2 diabetes, one of the missing elements has been that the analysis of these studies to date has largely provided relative abundances of different kinds of organisms that can be found, for example, in fecal samples. And our data would suggest that it's quite important to convert those studies to absolute abundance measures. Because if we hadn't been looking at absolute abundances, we would not have seen the variation in the composition of particular microbes that we found to be associated with certain metabolic parameters. They would have been covered over, they would have been obscured by the fact that there's lots of variation between individuals. But when we converted those data to absolute abundances, we were able to see multiple log orders of variation within this cohort of adolescents with obesity. So I think one of the takeaways that I would suggest to other investigators interested in this area is to take steps to design microbiome analysis studies now to include measures that allow you to convert your data to absolute abundances, because there's probably a lot of missing really good information out there that may turn out to be able to pivot the community's focus to these areas of absolute abundance differences and particular organisms that, when viewed from that perspective, are quite different and are associated with metabolic parameters that we know are potentially high risk parameters. So that would, for me, that was my major takeaway from what we observed. Quinn, I don't know what else you'd like to add. Maybe did you want to mention something about sex effects? Because I thought that was quite an interesting finding as well.
Right. So in the study that we did, we saw that the association between higher inflammatory level of inflammation is negatively associated with lower biomass, specifically in adolescent males. And we didn't observe similar associations in the females. So that could indicate that adolescents, male adolescents with obesity are more affected by this phenotype of having higher metabolic risk and having these enriched tasks that are associated with inflammatory activities. But we need to better understand the mechanisms underlying these kind of associations. Yeah.
And that going forward, studies really need to be designed to test for effects of biological sex on these outcomes. And often it's surprising how often it's not even considered. And people don't necessarily set up their studies in such a way that they can test for sex as a biological variable. And the data that we have would suggest that that's a really good thing, a really good practice in the way that we design our studies and analyze the data from our studies.